So we were talking about different. Yeah, it's live streaming now. So we have started with different perspectives. So under that we talked about, okay, biological, psychodynamic. Then we also talked about certain other things like behavioristic. Okay. Then we talked about humanistic. So what humanistic is talking about? Humanistic perspective is talking about. Okay, it basically says that, okay, all human beings are good by nature. They want to develop, they want to flourish. And Abraham Maslow, as we said, we talked about, so you have come up with a theory which is called as what? Want to talk or? So Abraham Maslow have come up with a theory which is called as Maslow's theory of Maslow's hierarchy needs theory. Did you remember that? Is my voice audible?
Yes, sir.
Okay, and you don't want to respond. Okay. Okay, done. So Abraham Maslow have come up with a theory which is called as, okay, Abraham Maslow's needs theory. Okay, you have arranged them in a hierarchy, that is from the basic to the higher level. Okay, according to him, the higher level is the self-actualization. So it is also called as the theory of self-actualization. Then the self-actualization, you have added another one which is called as aesthetic need. Okay, later you have added that. So according to humanistic perspective, so man or a person is motivated to move, okay, with the fulfillment of needs. So basically he start with basic biological needs, then he move to the higher order needs like self-actualization and aesthetic needs. So it is going to give the direction, and if someone is getting blocked, okay, so this is how they would get into the other maladaptions and get into distress if that particular goal is blocked. And also Carl Rogers is other person, other humanistic perspective. So he says everyone want to develop self. So development of self is the goal, or the person is motivated in a direction of self development. So if anything is blocking the self development, and this is how the person is getting into distress. Okay, so that is according to humanistic perspective. Then we have another perspective which is called as existential perspective. Okay, so existentialism is a school which talks about, okay, so what we are, so what a person is only because of what choices he is making. Okay, so he says what you are is because what you have decided, what you have chosen, what choices you have made for to get exist. So existentialism is talking about, so for being getting existed, so what all choices you are making, so that you are what you are is because of what choices you have made to exist, to survive, to function effectively with the environment and as per the situations you are challenged. Okay, so this particular existentialism says that, so when you are adapting or when you are making a wrong choice, so this is how you are landing up into distress because of the wrong choices what you are making. Okay, so this is according to existentialism. Is it clear what existentialism is saying? Existentialism simply talking about what choices we make. So it is saying what you are is because what choices you have made. Okay, if someone is making a wrong choice, and this is how you landing up in, okay, or if you choosing anything, and if you're trying to go with maladaptation, so this is how you're getting into maladaptation and ultimately getting into distress according to existential. Then we have socio-cultural perspective. So socio-cultural perspective is talking about society and culture. And when we're talking about society, so societal, okay, relationships. So relationships can be because of our attachment. We being social beings, so we would like to be in company with other people, social beings. So what relationships, what attachments you have with the close family, okay, extended families, then the neighbors at and large, okay. As a society, what relationships you have, and these relationships are going to tell either you are happy, satisfied, or not being satisfied, that is distressed, okay. So when you have a nice relationships, happy relationships, okay, cordial relationships with, okay, family members, neighbors, others, etc. So you are getting into a happy state, or you being a normal person. So when these relationships are getting disturbed, so ultimately you end up in distress. Okay, and also cultural viewpoint. So what are the customs? What all, okay, rights, wrongs? We have social norms. So when we are trying to follow the social norms, okay, so this is how you're being normal. But when you don't follow, don't understand the social norms, and don't try to fit into the particular social norms, so this is how, so you are getting onto the other side, which is called as, okay, deviation from the normal, that is abnormal behaviors. So societal relationships and the culture is having influence on what is, okay, normal and what is abnormal. Okay, so this is according to uh, socio-cultural perspective. Okay, then they are also talking about, okay, psychological causes. Okay, please write down psychological causes. So first one, early deprivation and trauma. So in the early stages, if someone is deprived because of, okay, troubled relationships, as we talked about in the family, especially children and parents. So when this particular relationship attachment is getting disturbed, so early stages is having huge impact on the person. Okay, so early interventions, and also childhood trauma. Childhood trauma. If person is getting exposed and is traumatized as a child, so this is also leading to abnormality. Then institutionalization. So institutionalization is about you being at a hostel or somewhere in an institution, okay, away from parents. Okay, so that is also going to make you sometimes being neglected, being abused, okay, trauma, etc. in the childhood is also making a person to get onto the other side, what we're calling it as abnormal behaviors. You agree with this? Childhood trauma, etc.
Yes.
Okay, institutionalization, okay, being away from parents, etc. Okay, maladaptive family structure and patterns. Okay, when family structure is getting disturbed, and also the other things with relation to the family, okay, is also making a person get onto the other side of adaptation, that is maladaptation. Then faulty parenting style. Can parenting have impact on development of a person?
Yes, sir.
Okay. So when you're saying parenting, so in what way?
Teaching ethical values,
Okay.
nurturing them, treating them with kindness,
Okay.
teaching them about empathy,
Hmm.
disciplining them the right way, and not inflicting pain or abuse.
Pain, punishment, you mean?
Yes.
Okay. Good.
Structured methodology, basically.
You mean a standard routine kind of a thing?
Not routine, but using the right words of encouragement at a given point of time, and molding them to be confident.
Okay. Encouraging them. Okay.
Yeah, encouraging them.
Acknowledging it, right?
Yeah, acknowledging their achievements,
Achievements, etc.
etc. Yes.
Okay, definitely. So parenting is going to have a huge impact on the development. Okay, and especially what we're talking from being normal or abnormal, or deviating or getting into distress. Okay, so definitely. So as your friend is talking about certain characteristics, okay, where caregiving, looking after, okay, etc. So they can be termed into different types of parenting styles. Okay, so please write down authoritative parenting, authoritarian parenting, okay, permissive, indulgent parenting, neglectful, uninvolved parenting.
So could you kindly share a screen or something, sir? Or
So,
maybe read them?
or if not, you can write down, it's page number 34 of that, in the
Okay,
book.
sir. Okay, sir.
Please write down page 34.
Yes, sir.
Yeah. So, authoritative parenting. So, they are warm, careful, okay, they're setting clear limitations, restrictions, they're allowing children to have certain freedom, okay, and this is a democratic kind of the approach. So what is a democratic approach?
To give equal importance to the child's point of view.
Good, excellent. Okay, so everyone is important. Okay, so not only as a parents, they're trying to pressure or they try to force the children to follow, but they're also considering children. So what they are looking for, what they are expecting, and what they are, okay, comfortable. So before making a choice or before making a decision, okay, before trying to fix something, so they are also taking children into consideration. They are giving them, okay, required freedom, etc. So authoritative type of parenting. Then authoritarian. Authoritarian parenting is of democratic. Complete opposite is what?
Authoritative parenting.
Authoritative. So what authoritative means?
Controlling.
Complete controlling. Good. One-sided.
One-sided. Yeah.
Okay. So they're not much bothered about, or they're not thinking about, okay, the other one. So that is the children. Or they may be following a strict discipline and they're not checking that with the children, whether they can follow, whether it is comfortable, etc. But only they are bothered about disciplining. Authoritative also, they are disciplining, but they are giving certain freedom. So we can see this complete opposite in authoritative, like we have authoritative bosses. Democratic boss, authoritative boss, or democratic management, authoritative management. So which one would be better, you feel?
Authoritative parenting. Sorry.
Authoritative or a democratic.
Democratic, yeah.
Okay, so this is about that. Then permissive, indulgent parenting. Okay, so parents are high on warmth but low on discipline and control. Okay, this type of parenting is associated with impulsive, spoiled, selfish, okay, demanding, aggressive behavior in children. They are high on warmth but low on discipline and control. Okay, this is another type. Then neglectful, uninvolved parenting. So parents who are both low on warmth and also control. The last one, they are both low on caring, taking care of them, and also they are low on discipline, least bother. Okay, someone is highly disciplined. Someone is disciplined but also giving certain freedom. So this is how there are different types of parenting, and based on the type of parenting, the type of warmth and care children are receiving, so this is also going to have impact on development of the self. And next, pathogenic interpersonal relationships. So pathogenic, nothing but spoiled or especially interpersonal relationships. When we're talking about interpersonal relationships, relationships with the other people, for example, marital and other intimate relationships, okay, because they are going to the source of need fulfillment, okay, they are going to give the ultimate satisfaction and the pleasure, okay, being cheerful, happy, etc. So when these interpersonal relationships are disturbed or when they are not good or as expected from the either of them, so this can also lead to distress among the people, and especially we are talking about interpersonal, in between people. So it can be a friendship also where we expecting care and warmth from other people and we want to give the same one. So when these relationships are getting disturbed, so this can also create distress among people. Okay, so this was about the different theoretical backgrounds or different perspectives or the causes of maladaptive behavior. Okay, then we will start with another topic, okay, which is called as anxiety actually. Okay, we're talking about block 2, introduction to anxiety, personality and mood disorders. So from this we will be talking about anxiety disorders. Okay, so what particularly you mean by anxiety?
Uncertainty.
Good.
Restlessness.
Restlessness. Good. Good. Being
Fear.
restless.
Yeah, fear of the unknown. Imagining.
Okay, future.
Yeah.
Worried about future.
Yeah.
Good. Then
increased stress.
Yes. Stressful condition.
Yeah.
Good. Then the question is fear and anxiety are different? When will a person be anxious? Or when will a person experience fear? Do fear have a reason? Or is it because of a fearful incident or an object as a reaction to that? For example, a possible danger. So what would be the reaction?
Being anxious. Scared.
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 If you have seen something which you think of some danger,
yeah,
then the natural response would be
being scared.
Fear. Yeah.
Panicking.
Okay, fear.
Yeah.
You have experienced or you have seen, you have come across maybe a environmental
environmental
factors. Good. Because you experience as a threat, then you experience fear as a reaction to that. But when we're talking about anxiety, so anxiety is more of future oriented or fear because of future, what is going to be. Fear which is immediate, anxiety most of the time because of some expectation. Maybe something is going to happen, something going to be fear. You're talking about something which is not immediate, and this particular thought is making a person get into, okay, into a stressful situation. Okay, so that is called as anxiety. The simple difference between fear and anxiety. Anxiety is also fear, but it is much of futuristic. The thought that you may be, something is going to happen, so that is making a person get into stressful condition called anxiety. So fear, most of the time, it is immediate behavioral reaction. Okay. So in this particular chapter, we are going to talk about different anxiety disorders. Okay. The first one, generalized anxiety disorder, phobias, panic disorders, okay, obsessive compulsive disorder, post traumatic stress disorder. Okay. I check if I have any. Okay, I think it is very slow, I guess, right? It is very small, I think.
Yes, sir, but we can see.
Okay, please, someone read it for me.
What is anxiety? Defined by American Psychological Association, anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. That's it.
So, what it is talking about?
It's an emotion carried by feeling.
Okay, good. Characterized by feeling of tension. It is a worried thought, and also it is accompanied by physical changes. Also. So there is a cognitive component, physiological component, then there is a behavioral component also. Okay. So what is the cognitive component?
Sir, we cannot hear you.
Sir is on mute, Ritik.
Hello.
Yes,
Yes,
sir.
sir, it's audible. Sir, you were on mute, sir, till now also.
No. Some technical issue. My net is got little bit slow. I join you in 5 minutes. Okay.
Okay, sir.
I'm checking
Okay.
out connection.
Okay, sir.
Yes, sir. Okay, sir. Thank you.
Hello?
Yes, sir.
Oh, is it audible now?
It's audible, but it's resounding, sir.
Okay, okay, okay. Now, little bit okay?
Yes, sir, it's clear.
Yeah. So as we were discussing about, or we have started with unit 4, which talks about, okay, anxiety disorder. Okay, so anxiety, it can be defined as, according to American Psychological Association. So anxiety is an emotion characterized by feeling of tension, worried thoughts, and physical changes like increased blood pressure, etc. So this particular, okay, definition is saying about like worry, you worried about the future. So there is cognitive as well as the physiological or the bodily changes also. So when a person is anxious, like for example, increased blood, etc., we can observe that. So there is a difference between being anxious and fear. So fear is an immediate reaction most of the time. Okay, then we were talking about different types of anxiety disorders. So there is generalized anxiety disorder, phobia, panic disorders, OCD, that is obsessive compulsive disorder, then post, okay, traumatic stress disorder. Okay, now what it can mean by generalized anxiety disorder. So a person is anxious, but when he cannot identify a specific causal factor. Did I make it clear? The reason, maybe object, person, is not being specific. So generalized anxiety disorder. Okay, so this is GAD, generalized anxiety disorder. So it was previously known as free floating anxiety. So there is no one particular, okay, reason. So it is in a common situation. Maybe this is according to, for example, our so-called behavioristic viewpoint. So they say that maybe a person is getting anxious, or when a person have learned to give this anxious response to one particular condition, and when they try to apply this particular anxious reaction to the similar situations or conditions where there is no one specific identified, okay, causal for that. So as a maladaptive response, if a person have given this anxious response, and when they try to apply this particular behavioral response in other conditions, similar conditions, so and if a person is getting into anxious, so this is called as general or generalized anxiety disorder. There is no one specific causal factor for this particular anxiety disordered condition. And when it comes to prevalence, so it is mostly observed in females with 60%, okay, and seen by the men. And when it comes to biological and genetic factors, so especially when we're talking about genetic factors, so there was observed that it runs in families. So there is genetic predisposition for this particular being anxious. And also when we're talking in terms of, okay, biological viewpoint, as we talked about brain and its communication process, that is conduction of nerve impulses through chemical compounds called, what are the chemical compounds through which communication will take place in the brain, or nerve impulses would be carried?
Neurons?
Yes, neurons. Neurons communicate with the help of chemical compounds called neurotransmitters.
Transmitters.
Yeah. So when we talk in terms of biological factors, so it was linked with a neurotransmitter called as gamma amino butyric acid. It's called as GABA, GABA, gamma amino butyric acid, and this particular quantity, when it is getting more or less, so this is also leading a person to get into anxious states. Okay, like other chemical compounds being serotonin, norepinephrine, etc. Okay, and prolonged exposure to stressful situations, including personal and family illness, excessive use of caffeine or tobacco. So, can excessive use of this caffeine or tobacco can lead into this particular condition?
Yes, sir.
So, this is how these chemical compounds, when taken and when they are withdrawn. So, when they are not provided over a period of time or subsequently, so this is also making a person get into anxious behavior. And as we know, childhood abuse is also cause of generalized anxiety disorder. Okay, so the person showing or getting into anxiousness, and it is applied to all other similar conditions or environments or situations. So there is no one particular causal factor or where a person is showing or getting anxious because of one particular reason. So that is called as generalized anxiety disorder. Okay, so the treatment of generalized anxiety disorder is cognitive behavioral treatment. Okay, followed by relaxation training. Okay, so cognitive behavioral treatment says that being getting exposed. Okay, so when a person is made to get exposed to the anxious situations, and when we can prevent the response. So what is the response here?
Cognitive behavioral treatment.
Yes.
Treat anxiety disorder.
Yes. So when we are saying that, we are exposing them to anxious situations and we are trying to prevent the response. So what we're talking about, response being getting anxious.
Getting anxious.
Okay. So it is as simple as that. So in the behavioral therapy, we are trying to make them get exposed to the anxious environment, situation, or familiar conditions with which they are not comfortable, and we are making them learn not to show that particular learned responses of getting into anxiousness. So response prevention. So this is how we make them get out of this particular anxiety disorders. And also the other technique is also called as relaxation technique. Okay, have you heard about this relaxation technique? Progressive relaxation techniques would be
counting numbers, breathing slowly. These are all, do they come under these relaxation techniques, sir?
Generally, we make them relax the muscles. It's called as progressive muscle relaxation technique. So generally, we start from foot to the head, and we slowly start making them relax one by one. So that is the reason it is called as progressive. Okay. First, we ask them to tighten the finger toes, etc., and then we ask them to lean so that they get bit relaxed. What happens generally, if we tighten and if we just relax them, can we sense that relaxation sense feeling?
Yes, sir.
So this is how in this particular training methods, so we ask them to tighten and slowly relax so that they get experience that being getting relaxed. So this is called as progressive relaxation technique. Okay, so that we try to do in this particular training. And when it comes to DSM, so did you remember DSM? So DSM is a manual where we try to assess, and we try to categorize different psychological disorders. So according to this disorder, the first criteria is that chronic excessive worry about number of events or activities. Okay, chronic, what it mean by chronic?
Long time.
Yeah, long time prevailing. It can be more than 2 weeks. Okay, for example, within 2 weeks, maybe if there is certain a reason for that, then it cannot be called as chronic. Or when it is getting beyond a prolonged time period, like more than 2 weeks to less than 2 years, etc. So that can become a chronic experience of this particular worry of future, etc. and with no specific threat present. So we should always remember that when we're talking about generalized anxiety, there is no one specific threat the person is identified. Okay, so that is the reason we're calling it as generalized anxiety, because there is no one specific identified threat and accompanied by at least 3 of the symptoms. Please write down the symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, or sleep disturbance.
So could you kindly repeat it once again?
Or if not, you can just note down the page number.
Yes.
41.
Okay, sir. Thank you.
41, they have given the DSM criteria. Okay, you can go through that. Okay, criteria A. Criteria B, the individual finds it difficult to control the worry. So when the person is not able to control worry. Okay, criteria C, the anxiety and worry are associated with 3 or more of the following: physical or cognitive symptoms. Okay, the physical symptoms like restlessness, keeping keyed up or an edge, being easily fatigued, impaired concentration, irritability, muscle tension, okay, sleep disturbances. So when a person experiences at least 3 of them, okay, this is how they have given a criteria: criteria D, criteria E, and criteria F. When person is experiencing, okay, at least 3 of them, and when it is chronic, then only we can tell or conclude or assess that the person is experiencing generalized anxiety disorder. Okay, it's not that simply the person has said, I am anxious, and we saying that you have this particular generalized anxiety disorder, because the person is not able to identify any one specific threat associated with anxiousness. So we cannot simply come to assessment, but we need to follow this particular DSM, as I said, which acts as a guiding, okay, for assessment, and it is followed throughout. Okay, so there is criteria A, B, C, D, etc. So as a professional, so as a psychologist, so we try to make them place on these criteria. When they try to fulfill or when they're fitting into these criteria, then only we will assess and we will tell them that they have this particular disorders. And it is not simply by what they're trying to tell and what my experience says, but there is a criteria. So that is the reason we have discussed about DSM, different axes also. How many axes it have? DSM axis, 5 axes would be there. Axis 1, axis 2, axis 3, 4, 5, etc. And axis 1 particularly talking about most of the psychological disorders. So we try to place them on the DSM, and then only we will try to come to arrive at a conclusion. So that is about generalized anxiety disorder. Okay, the next one is, okay, write down panic disorder. Okay, we try to look at this one particular disorder, then we try to wind off today's, because there was a little bit of disturbance. Will that be okay? Or if you have any other classes, you can tell me.
We have half an hour more, sir.
You have half an hour more.
Yes.
Okay. You want to have this particular thing as a relax or break kind of a thing, or can continue?
No, sir, we
No,
can.
no, sir. We can continue. The more we get, the more we are benefited.
No problem. No problem. No, don't worry about that, because within this particular schedule, whatever they have planned, okay, we're trying to complete it. Okay. So that is
because
from my
we
side.
are already struggling, sir. Like 2 major subjects they have allotted in the same time.
Same time.
And we are really struggling to hop into the classes and attend both, focusing on that particular part. At times, that's the reason I'm unable to answer to the class questions when you ask also.
I'm not looking at the screen. Who is this? Ushasri?
Yes, sir.
You yesterday also we missed you. Yesterday you were present but you were not responding. Okay.
That is what, sir. It was like one-on-one questions were going on other subject where
Maybe
only
you're
ma'am
also
and I
listening to
was
the other class?
present.
You're also listening to other class?
Simultaneously, sir. Yes, sir. Simultaneously, because we have to, sir. And in that class, only ma'am and I am there. When professors are coming forward and explaining to us, and we as a students, we should be responsible. And I thought I'll be recording the link, and Tripti, my partner, she's already participating. So I'll be digging her brain later to anything is left out. So I thought ma'am is alone yesterday in the class, and we felt.
Being alone.
And yes, and it is like as a student, like I'm a journalist student too. So like the thing is psychology, journalism. Last time all three public administration also clashed. So we opted for psychology and rest too we just recorded. But this time like very interactive, sir. Like psychology and journalism, they are literally completed. Like to choose one is like we cannot really choose the faculty because both of you are awesome.
So what this particular situation is called in psychology? When a person is compelled with two choices which are very attractive, where is compelled to take a decision. So what you call this particular situation? Okay, tomorrow you should tell me.
Oh, sir, you please tell, sir, because already.
Let you check. Then we will discuss tomorrow. So when a person is compelled to make a decision, okay, to compatible, equally attractive.
Sir, can I say it in Telugu, sir? Telugu word is
Go ahead.
Sir, Rakshaka Tandralulo Upagama Babita, sir. It's Babita speaking here, sir.
Good, but Rakshana Tantral was the defense mechanism, no?
Yes, the defense mechanism. In defense mechanism, we can see that no,
they call ego defense mechanism.
When two compatible situations is there, we can't compare both situations samely.
Conflict.
Yes, sir.
Yes.
Conflict is a condition where a person is compelled to make a decision from maybe two more compatible, or maybe one is compatible and the other one is not compatible. Okay, so two classes, both are important. The person have to make one particular choice. Equally they are attractive. Approach, conflict. The person want to have both. Want to attend an exam and also he have a family function like his brother's marriage, etc. Both are equally important. Whether the person would be anxious or happy, like my student Usha.
Anxious, sir. My condition, sir, certainly. This is exactly my condition. My brother's wedding is happening and my first exams.
Okay, you have this example also with you.
Fine example.
Okay. Sometimes one is attracting, other one is not attractive. Or for example, someone said, I can watch it later. This I cannot miss it. So no problem. There's a clarity.
No, I put my queries to Tripti before itself. Like my partner is present, so I am.
We are online.
Okay.
We are online. We are online, so we're not discussing everything in detail, and also we're not disclosing names, etc. Hope you understand. Huh? So one can be excluded, and one is not much attractive. The other one is very attractive. Okay, approach, avoidance. Avoidance situation. Both are painful. Both are not attractive. So which one you will pick? A small child don't want to attend school because you have not done assignment, so he would be getting punishment. At the same time, he also knows that if he don't go to school, his mother is going to kick him. You're going to get punishment.
Avoidance, no, sir.
Good. Avoidance. So which one the person will pick? Or what should be the resolution for this? Conflict resolution, conflict management. Maybe this is out of syllabus, but okay. But you are into this particular condition. So psychology class is na banta hai. You should know about it.
So the child will choose the one
To
which
go to
has
school.
less punishment.
Excellent. The one which is least bothering or less punishment. As I always said, pleasure seeking, pain avoidance. Okay. So getting punishment at school may be in front of friends. So maybe they may make fun of that. So to avoid that, the child may choose a safer punishment that taking punishment at home, because maybe this is less painful when compared to the other one. Okay. So in our general life, so we definitely come across these type of conflicting situations. So this is how you try to resolve them. Okay. The first one, approach conflict less stressful because both are going to be happy ending. Both you like. Getting seat at 2 colleges, getting 2 jobs. So ultimately, if you leave one, ultimately you get into job. You agree with this?
Yes, sir.
You
We do, sir.
look for an admission, or you are looking for a job. So ultimately, the decision is ending up with happy ending. You're getting a job, happy. But which one you choose is a problem. So when you have only one offer, no problem. But when you have 2 or more offers, especially at the time of admissions, especially children, you can observe them. So which college to pick, which college to give number 1? It should be 2, it should be 3, 4, 5, etc.
I faced this, sir. I faced this.
Yes,
2 jobs. 2
yes.
jobs. One in India and one in the abroad. The same situation. What to choose?
Good. Usha have everything. She's a live example for everything. So one day we should listen to her. Okay. Okay. So admissions, jobs, etc. But ultimately, it's going to end up in happiness. Avoidance, both are punishment. The person is going to pick the one which is least or less painful. But the only thing is with approach avoidance. Equally approaching and equally avoiding. So equally attracting, the person want to get into this, but equally it has some negative consequences also. Getting a job, but overall India post. Okay, you made a choice, but it has some other consequences also. Okay, because we are online now, I cannot tell each and everything because it can be sometimes prejudiced, or maybe we.
Sir, you can share your numbers, sir, so that we can have a brief discussion after sessions also.
Okay.
Because really, as a psychology student, we should know about all these kind of situations.
Done?
Yes, sir.
Okay. So the second one being more stressful because most of the time, or when you come across, when you take advices also, most of the people, they would be talking about negatives. Are being posted at that particular place, maybe you should avoid. Maybe that person ended up like this. And most of the time, because of this negativity, or people more strengthening, or they're talking about negativity, most of the people, they try to lose the opportunities. But when you are into this approach avoidance conflict, it's better that you also talk up the advantages or the positivity what it's having. And if you can take up the particular choice, would be better rather than simply leaving this particular opportunity. Okay. So with this, now you should try to come out of your anxiousness being this is a distress. So when you have choices and you have to make pick one choice. So it's very stressful situation. So this is about conflict management or conflict resolution. So this is not from our class point, but in the entire life, you come across this type of situations where you are forced thrown into this situation and you have to come out of it. Okay, so as a psychology student, so you should be able to know what this particular condition is called as, how many types it can be, and what or how to resolve these conditions. Okay, so it's already 1:15. Okay, it's better that I end up. You have 10 to 15 minutes break, then you
So
carry
one
on with the
question,
other class.
one question regarding this,
And
sir.
tomorrow we will continue
Like why
and we'll
it
try
is
to complete everything. Go ahead.
so one question, sir. Like why general anxiety disorder most common condition found only in females?
Maybe exposure. They're being less exposed to the situations and they're trying to generalize the similar conditions. So according to behavioristic perspective, as we know, conditioning, classical conditioning, etc. So you try to condition or you have learned one particular type of anxious behavior, and maybe you're trying to generalize or apply that particular learned behavior or learned response to the other situations leading to this. Okay, it doesn't mean that men don't have, but it is a little bit more seen in females because men maybe repeated exposures or maybe they are thrown into or if they are getting exposed to this type of situations, no, so that would be little bit low compared to the woman. That's it. Other than that, no. Or maybe if you think that they are a little bit sensitive, this is how they're also getting more anxious. You agree with this?
Yes, sir.
Sensitivity?
Yes.
Okay, then, chalo. You carry on with the other class. What is the other classes you have?
Public ad, sir.
Public ad.
Public.
Usha is also having public ad.
Yes, sir.
So you all are friends. You as a group joined the other class now. Most of them.
No, we
sir.
from first grade, sir. We used to attend offline classes.
Okay.
But unfortunately, because of COVID,
Yes.
we're only attending online classes.
Yes, I understand. Chalo then,
At
see you
least
all.
we are getting some classes because of COVID reasons, but actually offline classes also we face a similar kind of things. And first 3 years we struggle to get the class only. Means like first 3 semesters. First 2 semesters we even did I myself have to write a application to the Begumpet college, ma'am, that we are not getting psychology classes, at least basic conditions to unlock the because of the symptoms, means like terms and all. How to unlock it, because the terminology we are unable to, we are seeing that terminology into different directions. Like there need to be a right directions to be turned out to see the perception of the concept. Like till now the 3D perceptions of the concept, the perception of 3D way, I still have, because I have studied on my own, I have still have a doubt. But when practical kind of things comes, like how to unlock it, to write it on a paper, okay, we have seen in the book, okay, we mug up something and which we don't understand. But in practicality, when we are presenting, when we are relating with the patient, when we are seeking a kind of a job in the psychology, means like being a counselor, if we don't understand others, uh, then we will be certainly not justifying. So though it is online classes, at least we are getting some kind of direction, which is actually streamlining us in a proper way. We are thankful for this initiative. So thank you.
Good, and I wish that you get the other chances also. Maybe this is not the end. No, you have another semester, right?
2, sir.
Yes, sir. Two,
Yes,
three
sir.
semesters, fourth, fifth, sixth, three
We're
semesters.
having
Okay, I wish that you get maximum exposure and you get maximum benefit out of the classes. Chalo, take me leave.
It is
Thank you, sir.
offline classes. We may,
Thank
if
you,
you
sir.
get professor like you, we will be exploring more. So we will be like taking more than what we require. You will be like Akshaya Patra to us, sir.
Sir have left already, Bindu.
Yeah, left. Okay. Thank you. Okay, we will catch up
I'm
tomorrow.
also
Bye-bye.
leaving. Bye.
Bye-bye.
Bye-bye.
Bye bye. Babita leaving.